Hello everyone, myself Dr. Sharat KR from Bangalore. Greetings from Bangalore. You are watching knee arthroscopy. We are trying to repair large bucket handle tear component of medial meniscus along with radial tear. This boy is aged about 22 years. He got this meniscus tear while playing badminton. Now he comes with pain and locking of the knee. We are trying to do repair of the bucket handle tear along with the radial tear. You can see one stitch we are putting at the mid of the bucket handle tear. This acts like a traction stitch which will hold the capsule to the medial meniscus and around which now we will be doing multiple stitches. This is inside out needle first we have used. The second one is now in the either side of the radial tear component. You can see that radial tear is in just in the white zone. However, we are trying to fix this radial tear through inside out needles. You can see that this also indirectly fix the bucket handle tear also. You can see the meniscus is now taking its shape, and with the two stitches we are able to connect the meniscus to the capsule. Now posterior most part, posterior horn near the root of the medial meniscus, we are using all inside type of needles, all inside type of stitch where we cannot use the inside out needle. Now this one will be holding to the capsule again, and this prevents the continuation of the tear. Now anterior most part we are now trying to fix the meniscus red zone to the capsule so that it will hold the meniscus which the tear is starting from the anterior part. For this we will be using curved single lumen cannula. This cannula will be curvature will be directed to the front anterior part, and the stitches will be holding the tear torn area. Now after we put the inside out needles, we will be repairing this from outside with the release incision, and we will be using the sliding knots. And once we use the sliding knot, we will be now visualizing the meniscus after it is repaired. Now you can see that meniscus is very nicely repaired, and it has taken its shape. Now we will be sending him for rehabilitation and then further exercises and training for sports, going back to the sports. Thank you for watching this video. I hope you have liked this video. If you have liked this, please subscribe to my channel and don't forget to subscribe. Don't forget to share to your friends and family members. Thank you again.